Hi, I'm Mike Morrissey. Every year, a group of 30-plus medical professionals travel to San Lucas Toliman in Guatemala to perform orthopedic surgery on local children. In March of 2019, I joined the team to document their work.
My name is Mark Backman. I live in Anacortes, Washington. I'm married to Mark, and we have 3 children, 4 grandchildren, and I retired 4 years ago. I'm an RN. I had worked at a community clinic in our area for 23 years prior to retiring. And I wanted to do something like this for a while, and we had talked about it. And I was waiting for Mark to retire so we could do it together.
Mark, what about you?
So my name is Mark Backman, and I'm a family physician, and I've worked in Anacortes, where Karen and I have lived for 38 years. I've known several of the people who've been really involved in this, Mark and Steve particularly, for 35 years. And they've always talked, when I've talked with them about their experiences down here, what it's about, and it was always really interesting and enticing, and it also kind of fed into that desire. As healthcare people, most of us want to serve, we want to give back, we want to help. I just want to help. That's probably the biggest way to state that. And this was a wonderful opportunity for us once we truly did get a little more time to be able to leave. And I remember when we kind of were making the decision to do this, trying to work out whether this was something we both want to do, and I think we both felt really good about taking off and doing something like this together as a couple. And we've traveled a lot together, but we haven't traveled in this way, where our focus was really service. And it's been fantastic. It's been a wonderful, wonderful week.
What has your experience been on this trip?
I think the focus, the energy, the camaraderie of the people who are working here is really, really wonderful. Half these people have worked together before, but very few of them come from situations in which they're working together day in and day out. And healthcare, and especially surgery, is really teamwork oriented. People work together, they know what to expect from the other. Here you've kind of put people together, an anesthesiologist who's never worked with a surgeon, who's never worked with a scrub nurse, and they have just jumped in and worked together beautifully. And that's a pretty remarkable thing. It's not easy what they're all doing back there, and it's worked smoothly.
Yeah, I would echo that. I think the individuals that are working with us, they have amazing stories, each one of them. So it's been fun to get to know them and learn where they have come from, what their personal histories are, and what brought them here. And everybody's been so supportive. I was pretty nervous because my job here is in the OR as a circulating nurse, and I have never done that before. But everyone was so supportive and helpful, and after the first day, I almost felt like I could do it. The circulating nurse in the OR gets the equipment that is needed for the case. And with orthopedic cases, there's a lot of different instruments. So when I just saw the amount of instrument stuff that they had, I was kind of overwhelmed at first and thought, oh my gosh, can I even do this? But like I said, everybody was very helpful, and all the way from the surgeons down the line. So it's been great.
How would you compare the difference of what you're experiencing at home compared to what you're seeing here?
Oh, there are worlds of difference. I think the first thing that really struck me was when we got a tour of the operating room area. And we walked into the operating rooms, and it was one room with 2 operating tables. And I'd never seen that, and I kept wondering, how can this work out? And at times, I've been back there in surgery, so I'm not doing any of the surgery as a family physician, though I can do some simple surgery. It's not the kinds of things that are helpful here, really. But I love to go back and watch, and at times there are 16 people in the room, all involved in this process of getting a wonderful outcome for one of these kids or individuals down here. And that's been a real eye-opener for me. I think when I worked, I'd done lots of different things within family medicine, so there's nothing I'm seeing here that's new that I haven't seen before, except for the kinds of problems you see, a clubfoot abnormality, for instance, which I see once every 5 years in a practice, and it's taken care of relatively early for a family and a child. Here it doesn't. We saw a child on our screening day almost a week ago who was coming down to have a clubfoot fixed, and that's obviously I'd learned that was a pretty common thing, but then learned that she had this also uncommon kind of neurologic disease, meningomyelocele. She's 9 years old, and this was her first exposure to the healthcare system, despite what all of us would consider to be a life-threatening congenital problem at birth, and it's just eye-opening. And it was fun today. She was leaving the hospital today. Her procedure went beautifully. She didn't have any complications, and there were concerns that she might. She's very small. And I went out and we were able to talk a little bit, and her family took photographs and honored us by having us in the photograph with her. And we get as much as I think oftentimes the kids do. It's a remarkable experience.
More.
Karen, you haven't worked in an OR before. What was your prior experience?
I worked in community clinics, so it's an entirely different world. And talking about what has surprised us, we saw children in our clinics when I was working that were the same age as the children here, but these children are far smaller. I mean, obviously they're nutritionally deprived and sweet as can be, adorable, but much, much smaller. And that surprised me. I didn't know that would be the case.
This is the first time the two of you have worked together as a professional couple, isn't it? How was it to work together?
I'd say it's been a lot of fun. It really has been.
It's great to be able to share an experience like that. I think if one or the others had done this, all you'd be able to do is come home and show the photographs and tell the stories and maybe be able to see a video, but to spend 10 days or 12 days and experience it together and know what we both experienced.
It gives us something to talk about besides the grandchildren.
Is there anything else you'd like to share about this experience?
I think, I've loved being around all the other people here. It's striking. Great people, committed people, fun people at the same time, energetic people, and that's been a really neat part of this. And to, again, do it a couples, it's been really good for us. So,
yeah.
And the kids are magical. They really are. And to see them have their lives improved like they're going to be so often is something that you'll take with you forever.
And very loving families. It's wonderful to see these children come out of surgery into recovery room and just the love they're getting from their parents. It's very, very touching, very moving, really nice.
This one other thing that struck me is the systems out there that bring both the children and the families and all the people and supplies and equipment. It's a really complex web, and I didn't appreciate that before I got down here. I started to appreciate more and more and more as we learned what we were going to be doing. But when you see people who are committed to a community 9 hours away, who are bringing children here for a week, not even sure that they're necessarily going to have a surgery, and they're committing huge, huge parts of their lives to the betterment of these kids, you just start to see this kind of web of engagement to making kids' lives better. And it isn't simple. This takes a lot of money to do this right. Medical equipment's not inexpensive, and to see the new C-arm that came in this week, that a day and a half before surgery was going to start. And it arrives here on a truck, and there's no way to hoist it off the truck except for 16 individuals to go pick it up off the truck and carry it in to the building and get it set up and get it working and troubleshoot a few little things. And I don't know how they could do several of the surgeries I've been observing this week without that kind of equipment. So things like that, and they're all over. All these kinds of contributions and support that you really do appreciate. Fantastic.
Yeah, it is.
How did you learn about the mission?
You said you did.
A little bit, yeah. I'm pretty good friends with both Mark Eshold and Steve Miller, and so have mostly learned over many years about their trips and known about their commitment, and I respect both of them very much. And so learning what they've been through over the years, what they've done, what they've engaged in, it was an opportunity for us. And the only thing is I'm retired now for not a year, but I've been retired. And I remember when I talked to both Mark and Steve, I told them I was a little worried that I wouldn't be able to carry my weight. And they both kind of looked at each other funny and smiled. And I think I saw Mark kind of wink over at Steve. And he said, "You'll be able to carry your weight, don't worry." And then when we got ready to come on the trip a week or 10 days before, they handed me 200 pounds of bags to carry down here. And indeed, we carried our weight, 200 pounds of bags, so that worked out.
Thank you both very much.